I am Dr. Ruth Roberts. I am the original holistic pet health coach, and I train passionate pet pros to be holistic pet health coaches, the trusted guides for pet parents seeking a more holistic way of caring for them, for their pets. And to that end, what I want to share with you today, I think that this will take us to full screen, which is cool, is a topic called Unleashing the Power of Functional Medicine for Optimal Pet Health. I know that most of you are in the functional medicine world in some way or another, but my goal today is to help you understand why this is so critical for pets, and also to understand the current limitations of conventional veterinary care. I mean, it's bad now, but literally, I think by the year 2030, we're supposed to be 24,000 small animal veterinarians short, which is not good. I'll also give you some concepts of basics of functional medicine for pets and how to apply them to dogs and cats to really address the root cause of their health issues. And then I'm hoping to chart a course, or to help you understand the course that I am charting for the future of pet care. As I mentioned, we're reaching a time of a critical shortage for veterinary care, and the profession, my profession, is really not doing anything about it. So we can either wait for someone, or we can take action, even if we're not sure of what the outcome will be. So I'll show you a little bit more about that. So why am I so passionate about this topic? Like many of you that have come into alternative healthcare, you've had a health problem yourselves that conventional medical care couldn't resolve. Same thing for me. In 2006, I was diagnosed with fibromyalgia and IBS and all the things, and I was able to really get those controlled through functional medicine using whole food nutrition. And this is what started me asking, well, why aren't we doing this for pets? And so to that end, it's been a really interesting journey, but where I want to start is why things aren't working now in veterinary medicine. And much of it is because the young veterinarians are being taught decision-making based on flowcharts. And these are awesome, right? Because they give you guidance about where to start looking. They're the basis for decisions, but many veterinarians do not know how to look past or think past the flowchart. And we are taught, these young vets are taught to refer everything to a veterinary specialist. That's becoming a massive issue, because for every internist that is completing their program, there are 100 open positions. So if we don't have the general practitioners that understand how to handle basic cases of diabetes, basic issues with kidney disease, then pet parents are caught in the middle. I know many people are waiting 6 weeks to see a veterinary oncologist for a cancer that could kill their dog in that period of time. It's really getting scary out there. And then the other component, much like human medicine, the veterinary specialists only look at their specialty. So there's no one running quarterback or managing the team of care for the veterinary patient. That's part of what is supposed to happen with the general practitioners, but clients are being caught out in the cold. And if you've had this experience, you know what I'm talking about. It is really hard to get the right hand to talk to the left hand so that problems don't occur simply from somebody prescribing over the top of somebody else's game plan. Now, the other thing is that there's very limited research being done by anyone other than drug companies. And as you might guess, most of that research is geared towards proving that the targeted therapy, the drug they want to launch, is effective. And the numbers that are required to do that are shockingly low, which is why we've had a lot of bad products enter the market. There are only a very few groups doing research into how lifestyle impacts health in pets. And we are starting to get some really great information out of those studies. But again, this is going to take 10, 15 years to really begin to understand what makes a difference. So to that end, one of the most recent studies is that pets that eat once a day actually live longer and better than pets that eat twice or three times a day. They made no differentiation in what the pet was eating, which is cool in terms of making that. But what they did find is that whole foods that were fed to pets did seem to prolong their lives, even if they were eating twice or three times a day. So all of this and the advent of COVID has led to a drain of the wise and seasoned talent in the veterinary field. So I'm 60, anybody my age or older was like, heck with this, I am out of here. They retired, they sold their practices, they got out of veterinary medicine. The veterinary technicians, our nurses that are so important and critical for patient care, were bearing the brunt of all this client aggression during COVID and frustration. And they're like, heck with this. I am going to go work at McDonald's because I can make more money, which is just tragic. But because of this, these young vets, again, they're following the flow charts. They're not able to think critically to say, oh, well, okay, this is what the flow chart says, but what I'm seeing is this in this pet. They have no desire to go off that book. And then the other thing is that this introvert profession still wants a curbside only practice. They are reminiscing still about the days of COVID where they didn't actually have to talk to other humans. So it's really been frustrating for you, the pet parent, and for people like me and my colleagues who are performing essentially second opinions. Now, too many buttons here. All right. So the other massive thing we're dealing with is an epidemic of cancer. These statistics are still just baffling to me, but they do seem to bear out. So the American Veterinary Cancer Society estimates that 25% of all dogs in the United States will develop cancer. That is ludicrous. And 50% of dogs over 10 will develop cancer. Now, cancer in humans is what? The number 3 cause of death in the United States? The incidence of cancer in humans in the US is 5.5%. What the heck is going on here? So for frame of reference, in the Italian Cancer Registry, there were, and they break this down into dog years and for males and females, and then the average lifespan in Italy is somewhere between 10 and 13 years. So breaking this all back down into percentages, the percentage is 1.11% for male dogs and 3.26% for female dogs. And the cancer that they are dealing with most often in Italy is breast cancer. Now, why is this? And one of the answer is, shockingly, early spaying and neutering. And I am coining this term of spay-neuter syndrome because I think it really accurately reflects what's going on with chronic disease in our pets. There, all of these other things, the high carbohydrate, highly processed food, that's not a good thing. The flea and tick medications that are given both topically and orally, pesticides, those aren't good. Over-vaccination, that's not good. Environmental toxin exposure, that's not good either. But apples are to apples. No other country has this level of cancer incidence other than the US. And this is where we have gotten our pet overpopulation problem under control, but at a cost of horrible chronic disease, horrible cancers. So what I'm hoping to provide you is some answers on how to avoid that. And to that end, I work with 3 key systems of functional medicine to support dogs and cats. So detoxification, assimilation and digestion, and controlling inflammation. The other parts are important too, but it's much easier to get the average pet parent to start working in this frame of reference. And if you are in the functional medicine world, or you've had exposure to it, you know the drill. These are the same issues that you see and you support in your clients. Detoxification is extremely important because pets have an increased exposure to environmental chemicals because they are lower to the ground. They're sniffing the dust up off the ground, which contains all of the stuff we're trying to avoid, the glyphosate, the DDT, the microplastics, the nanoplastics. And they have often pesticides applied directly to their skin, or they take them orally. And again, as I said, they are spayed and neutered early in life before they ever develop endocrine competency. One other thing to remember is that dogs have 69 times the toxic load of humans, and cats have 93 times the toxic load. And if you're in the functional medicine world, you know that one toxin plus one toxin isn't two, it's 10 or 100. So the more stuff you are carrying around in the body, the more amplified your body is in terms of dealing with all of these toxins. The detoxification system is way overloaded, and this leads to issues with digestion, assimilation, and inflammation down the road. So it's all sadly interconnected. So one of the most important things you can do is to use a home-cooked whole foods diet, which improves the process of detoxification by providing vegetable-rich fiber to improve the microbiome. And it turns out that it's not just the fiber, it's actually the polyphenols in the plants. So that's why we want to, again, feed the rainbow for our pets. And that's really critically important. So carrots, bell peppers, radishes, things that are red, so the whole spectrum of colors to help support. We know that brassica vegetables help improve the liver's ability to detoxify by providing really, really critical nutrients to support the liver. So those DIM molecules, the sulforaphines. And we know that removing a highly processed, high-carb, pro-inflammatory diet and replacing it with an anti-inflammatory whole food diet is critical to help improve the detoxification system and the digestive process. There are a boatload of supplements that we can use, and see, these are some of our favorites, and binders, I think, is one of the things we're sort of late to the party on in veterinary medicine. We're still talking more about activated charcoal, clinoptilate, things like that. And then I think there are better options in terms of fulvic acid, humic acid, C60, which is another one of our favorites. And again, pets develop leaky gut syndrome just like humans do. And for most dogs and cats, they end up developing skin disease secondary to it, or they develop the skin disease and then the leaky gut comes. There's some debate about which is first, which is the chicken, which is the egg. The other thing that is incredibly common is inflammatory bowel disease or syndrome. And the distinction is between those two diagnoses, how many medications the pets are on. IBS can often progress to intestinal lymphoma, especially in cats. So again, it is really critical to get this inflammation and digestive process back under control. So again, these are going to be concepts you're already familiar with, using the anti-inflammatory whole food diet, healing leaky gut with, I use many human supplements because I found that the dosages are appropriate and they are much more effective. And then using a bioresonance test, sorry, this didn't catch this one, to determine food sensitivities. These are awesome tests because it's something you can do at home. You take a little saliva, you take a little bit of hair, you send it in, and in about a week to 10 days, you get a profile on foods that your pet may be sensitive to. It is the most effective, least expensive method I've found to really look at food sensitivities. And then we will use the test results to develop a rotation and elimination diet for that pet. And what that means is developing 3 recipes of very limited foods and then rotating those every 24 hours. And in doing that, what we're doing is helping the gut calm down, helping reduce the immune response to what the dog is eating, and helping the gut to heal. And again, using probiotics, gut healing supplements, high doses of omega-3 fatty acids are going to be critical here. And then again, binders. So you're seeing the the patterns start to develop, right? Because all of these mechanisms are tied together. And then lastly, with inflammation, if we can control inflammation, we know that we're going to reduce or slow chronic disease processes, because we know also that inflammation is underlying every chronic disease process, including cancer. Because pets have increased pesticide exposure, environmental toxin exposure, the high carb diet, and they've never had endocrine competency, they are more profoundly affected than we are. So if you go back to the idea that dogs are carrying 63 times the toxic burden we are, and cats are carrying 93 times, it's really critical that we get this process under control as well. Now, one of the things that has been problematic both on the human side and the veterinary side is that conventional medicine prefers to wait until something else happens, until action is taken. And what that often means is that we're supporting pets once they have the disease in its most fulminant or damn close to end stage form as there is, instead of actually preventing that disease and preventing the mechanisms that create that thing which we can now name dermatitis, intestinal gastritis, nephritis, any of those things, hepatitis, all of this stuff. Anything you can stick an itis on is inflammation of the thing that it's stuck on the end of. So instead of preventing the disease, we're waiting until it happens to take action. And even then, sometimes the response you get from the vet is, well, we can't really do anything else except for feed this expensive bag of low protein food in the case of kidney disease. And to me, that is just completely unacceptable. So when I see pets that have cancer, kidney disease, itchy skin, sensitive stomach, and this is often how pet parents describe it, I know that they already have leaky gut syndrome, they have moderate to high levels of inflammation, and they are on their way to developing something that a conventional vet can name. So my goal is to help you know how to prevent your dog or cat from getting there. And what I will tell my folks, and now I'm teaching my coaches to teach their clients, is to use a whole food diet. And I'll talk a little bit about raw versus cooked in a minute, but using adequate doses of omega-3 fatty acids, using free radical absorbers like C60s, probiotics, especially Megaspore, which is a human probiotic, but I find it works extremely well because it's able to actually get into the colon where it's supposed to do the work. There are marvelous mushroom tinctures available, and also full spectrum hemp extracts, which are marvelous for supporting the body getting back into homeostasis. And then there are other things we can do to help control inflammation as needed. We can use turmeric, we can use arnica, we can use traditional Chinese veterinary formulas. There's a myriad of other options out there in terms of herbals and other preparations. And lastly, probably not lastly, but one thing I do want to address is why not raw food? Because for many of you, if you're watching the pet side, you're seeing my colleagues and all this influencers say that, no, this is the ancestral diet for dogs. What I'd like you to consider is this, is that data shows that dogs split off from wolves over 40,000 years ago as a separate species. People had been cooking for 50,000 years, both Neanderthals and Homo sapiens. And Canis familiaris, our dogs, evolved eating our Homo sapiens garbage, meaning also poop, which is part of why their microbiome is similar to ours, and then our leftovers, and then what we fed them. So one study I'd like to show you too is this one which compared street dogs in Laos, pet dogs South Africa, which eat a similar diet to US dogs as far as this kibble that's very highly processed, and then stray dogs in India, which they're sort of eating kind of whatever they can, including some kibble, and then an ancestral microbiome of dogs. And what they found is that the Laotian street dogs had the most similar microbiome to the ancestral dogs, and their diet consists primarily of leftover food, which is going to be largely rice and vegetables. There's not a lot of animal protein in Laos for people, let alone for pets. So that was a real eye-opener for me and really added credence to what I've been teaching over the last 15 years. So the idea that the raw diet is the ancestral diet of dogs is correct, but it really is for the progenitor species, which is the wolf. And the raw diet is also our ancestral diet, but it is for two progenitor species prior to us. And the other thing I want you to consider is that only recently, say within the last 50 years, has meat been available in such large quantities, not only in the US, but in other countries. And now we're importing meat from Argentina, from Uruguay, from much of Central and Latin America. And this is having fairly large environmental consequences because they are destroying their native forests to create pasture land for animals. So I think this is something that we need to look at on many levels. One is it the healthiest thing for dogs? And the second is this supporting the health of our planet? And I would say no to both. I will tell you that cats truly are obligate carnivores, and this probably is. Raw diet probably is the healthiest diet for them. However, many cats are carbohydrate addicts, and getting a cat onto raw food is a real trick. So think about that. The other thing I wanted to mention, there's another study I read about just last week looking at comparing the microbiome of dogs to wolves. And so comparing them when they're eating kibble, when they're shifted to raw, and then to see if that shift developed a similar microbiome and if they were able to sustain that microbiome of wolves. And the interesting thing is it did kibble and raw, totally different microbiome analyses. But when dogs were eating raw for a period of time, they got closer to that of the microbiome of the wolf, but it was still quite imbalanced. So that was quite eye-opening as well. And they kept them on this diet for 6 months to see if the microbiome should shift over to that of wolf. And really what they found is that the shift took only about 2 weeks to complete. So now what? You can't get into the vet. The shortage isn't easing. When you can, often the solutions that the veterinarian is offering you are worse than the disease itself. And then this is incredibly costly. I mean, there are people that are going in, they're dropping $3,000, $4,000, $5,000 and still not getting answers, which is incredibly heartbreaking to me that my profession has shifted into this mindset of testing, but not supporting what we see in that animal in front of us. Now, I don't want to throw my colleagues completely under the bus. Unfortunately, because veterinary medicine has been corporatized, many veterinarians don't have the time to really think through the case and discuss it with you. They're in the place where many human doctors were 30 years, 40 years ago, where they now have 6 to 12 minutes to do an examination, discuss results of the examination with the client, diagnose, treat, and prescribe. And the other problem is that they are so burned out because of the overwhelm of work they're in that they simply can't think their way out of a box. And I've been in that position in practice, and it is absolutely miserable and stressful and demeaning because I knew I was not doing the right thing. But what's happening with many of my colleagues is they cannot even handle being able to discuss things with you because then they have to admit that maybe there's something they don't know, and they don't have the time to learn new tricks, so to speak. So when I was looking for solutions to this problem, I looked at human health coaching because it truly has been a revolution in the way healthcare is provided to people. It puts the responsibility for health firmly back in the court of the individual. That's what I want to do for pet parents. You know that you know your pet best, but you don't know what to do sometimes. And health coaches are there to act as the knowledgeable guides to help individuals understand the root causes of what's going on with their pets, the impact of their choices or lack of action, how to make better choices, how to form new habits, and ultimately, how to become as healthy as they can be. So, because of this success on the human side, I developed this program to train people to be holistic pet health coaches. And amazingly, this program got approved for 40 credit hours through the American Association of Veterinary State Boards for veterinarians and veterinary technicians, which is 2 years of CE credits for them. So this program is directed towards that level of education and understanding. So what the women in this program are doing is really, really intense. And we do actually have some men joining us finally, which is awesome. But the premise of this program is to teach passionate pet parents, pet pros, such as dog trainers, groomers, pet sitters, veterinarians, veterinary technicians, and assistants. And I should add human health coaches that have been hearing from their clients, can you help my dog? Can you help my dog? How to be the trusted guide for people's beloved dogs and cats. So again, we're educating people on the concepts of physiology and anatomy for dogs and cats, educating them on the concepts used in conventional medicine, how to use the original crock-pot diet, which is my version of a home-cooked diet, to support pets. It's extremely flexible and easy to use. Concepts of functional medicine, concepts of traditional Chinese veterinary medicine, and then supplement strategies and dosing. And we do this with pre-recorded material and then coaching calls, mentor calls, and by evaluating person's work throughout the course with the video and written homework. And then the final examination is people actually doing 2 recorded calls with real clients, showing how they can help them, demonstrating their level of knowledge, all of those good things. And again, we've got weekly coaching calls with me to support them, listing on our holistic pet health coach referral page after they graduate. And that's something that if this is of interest to you, we've got some discount codes here, which we'll get in the comments. And then the other thing that I want to gift you today, if you do nothing else, please, please, please start feeding whole foods for your pets. If you hit that link, scan me, what have you, you'll get the original Crock-Pot Diet ebook so that you can start understanding these concepts and start cooking for your pets. And I think that is what I have today. So I'm gonna stop the share for a second so I can find, where are we? So I can find this and minimize it and then go from there and answer questions so far as I can. Yeah. Yeah, so I love this. So Paula, I totally get it. You face a lot of opposition return in town regarding holistic animal care. And that is not uncommon with many veterinarians because they feel threatened. And I get it. If you know what you're doing is not right, but you don't have the time to figure out a new way, it's tough. And I get it too, Lisa. I think Hayo would flip her nut if we only fed her once a day. And Constance, great. I am so excited for you. And if you're interested in this program, I think that it would be a great fit for what you're doing. That's amazing. Food allergies are huge, right on. Jen, yeah, real mushrooms is a great product, and they actually use the mushroom and not the substrate too. The other one that I really love is Myco Dog by Angela Ardolino because they're glycerin-based extracts, so super, super awesome. And right on, Karen, exactly. And then you can apply those same principles. And again, I think if you're doing this already, you would be able to really amplify this quickly. So, Bonita, your dog has dementia and sundowners. So think about it this way. In humans, what happens with cognitive dysfunction, with Alzheimer's, dementia, et cetera, et cetera? This is a situation where people have brain inflammation. And so we know about leaky gut, right? Do you understand the concept of leaky brain? Have you heard that one before? Similar to leaky gut, there's a very thin membrane lining the brain. And if this is not intact and it becomes permeable, then things that shouldn't get inside the brain do. And this is part of what is going on. So this is a situation where if your dog can tolerate a high-fat diet, a keto diet is an excellent option. And in fact, there are keto recipes for the original crock-pot diet. And then many of the supplements we would use for people with dementia will work here as well. And again, in the Mica Dog line, there is a mushroom tincture called Clarity, and it is really awesome. And we've seen a great improvement in terms of cognitive function in many dogs. It's wonderful for anxiety as well. So that's a great option. And then, Benita, what do you do for a living? Are you a health coach or into that world, or?
I'm a naturopathic doctor, digestive health specialist. So I've had her on, like, I've got her on essential fatty acids. She's been on probiotics, enzymes for years. Along with, I started her on PC, phosphatidylcholine, which is a of phosphatidylserine, all like inositol, all those as well, because I've told that really would support her as well. So yeah, I feel like I'm doing so much, and she's not. I don't know. I didn't even know if I could trust that my vet, if she's throwing stuff at the wall or if that's legit. And her only signs are at night, she's getting confused. She'll get up and kind of wander around the house and then come back to bed. So
Right on.
yeah, so that's kind of the only thing that we're noticing. And sometimes she stares at a wall and barks, so that's a little odd, but
Yeah. And that's cool. So the question to ask yourself is, when you started those things, have you noticed an improvement?
It's been about 2 months, and not well, a little bit, yes, because she was getting up 3 and 4 times a night. And now it's down to 1. So we are seeing some improvement, but I'd like
Good.
to see a little bit more, I guess.
Exactly.
Yeah.
So there's a guy named Titus Chu that wrote a book called Leaky Brain Fix. And so that's a great overview of the topic. But again, this is where, like, let's drill it all the way back down. And this is where one of the coaches can really help you. Do a food sensitivity test, fix the
Yes,
gut,
I would
start
like
cook,
to.
I mean, that's really critical, is get down to the basics, get the underlying inflammation under control, use other things that will help support better brain function. So again, Clarity, alpha lipoic acid, C60. If you're not familiar with that,
No.
yeah, that's a great supplement, and they're not out there, but as wide as they should be. But for dogs and cats, it's a no-brainer because it's a few drops of oil into the food. So it's super,
Oh,
super easy to get them to take.
okay.
But
And then
that's
you
been
offer the testing as well, so you have access. We can get that through you.
exactly. So if you, Delora, if you could drop in a link to the coaches page, that would be super awesome. But you know, these folks can guide you through the steps so that you understand. And it's hard when it's our own family, right?
Oh,
Because we,
it's gut wrenching. I mean, we thought we were going to lose her. So, I mean, so like I said, it definitely has helped. But like I said, we've always fed her so well. So that's what it was so hard. Everything is, monitor her toys, what she, everything she eats and puts in her body. So, but again, she's 12 years old. I know that's, English bulldogs don't have a super long lifespan, but they ran all the
exactly.
traditional tests and everything came back. Oh, she's perfect. And I mean,
Right. Yeah, the paper is fine, but your dog is not well, right?
yeah, yeah, yeah.
Yeah. And that's my teacher at the Chi Institute, Dr. Shea, would, students will come up to him and say, Dr. Shea, what do you think about these blood work? And he'd look at the paper and he'd say, the paper has no chi, and throw it over his shoulder and go stick needles in the animal. So that's the thing that we've lost, is we're looking only at the paper and not at who's in front of us. And
Yeah.
that is so, so critical.
Yes.
So yeah, check that out. The other thing that you can do in the short term that I found really helpful is if you have a really high quality lavender essential oil, there are 2 points right behind the ear that we call anshin in animals. In humans, they're called ambien, and oddly enough. And so little drop of lavender, massage both of those spots like 45 minutes before you know that sundowner starts to wind up, and see if things are a little bit easier. The other
Okay.
thing is pulsed electromagnetic frequency is awesome for cognitive issues, amongst other things. I mean, it's just amazing what this technology can do. And again, it's something you can do at home on a really frequent basis, on a daily basis, to start to get the inflammation in the brain to settle down, start to really see an improvement in how your pet's feeling. So I can't recommend that strongly enough. We started partnering with a company out of Slovenia. They've got a mat that is highly adjustable for $400, better quality than anything else I've run across. And they're called PetSpiff. They're on our website too, but that's a really excellent product.
Okay, excellent. Thank you so much.
With
This was
pleasure.
great. I was so excited that you were going to be here. I was like, I need
Oh,
some help.
good. Good. Yeah. And Paula, how can I help you? What you got going on?
I just wanted to say that I work a lot with traumatized animals, with unknown past history, and oils are great, but I have to say, flower essences are amazing when it comes to working with animals with PTSD or had major trauma in their past or going through sundowners. It's just really powerful. It's not oil based like an essential oil, but rescue remedy, I call the big gun when it comes to something I can't get through on the animal emotional side. And I just wanted to say that. So
I appreciate it. And that's interesting because I have to say, and maybe this is an inappropriate use, but people would use rescue remedy to come into the brick and mortar practice. And I would say 1 out of 1,000 pets responded to it. But I think that if you understand the principles better in the flower remedies, they can be absolutely amazing.
mhm.
Cool. What else can I help you all with today? And Lisa, we will follow up because you should have heard back really soon. So we'll find out what's going on with that. And Aza, please, if I can help you, please ask questions.
Hi, doctor. How are you? This is Asa
Very well.
Navarro. Yes. Have you heard anything about a quantum diagnostic, call it NLS, or this is a linear this is a computer where you put the data or the information of your pet, and then it diagnoses like what organ is it's not harmonized well, and then that can tell you like it can go by this disease, it can go by that. So have you heard anything about it?
Claro que sí. It's interesting. There are a lot of these machines out there, and I think that they depend on the level of effectiveness depends on the operator. Many of them are designed to sell products, but I have seen people develop really beautiful homeopathic remedies with this. And you're absolutely right. The idea is that when the organs are in disharmony and not resonating their correct frequency, I think it can
Exactly.
be a super, super useful device.
Thank you.
Cool. With pleasure. Con placer. Anything else I can help you all with? And happy to drill down. I'm sorry, this went much faster than I was expecting. So I guess I've been saying these things well enough, but any questions I'm happy to answer with you. And Jen, 15-year-old border collie, set your 15-year-old border collie mix up for success after his teeth cleaning next month. So, yeah, there's a couple of things. So going in before anything, it's not your fault. It's just the way it is. So the ultimate thing is that you're going to get it fixed and help this guy feel better. And what I would do is go down the pathway of setting up his body to reduce as much inflammation as is possible prior. So that would include high doses of omega-3 fatty acids. There's some folks that say we should withdraw them for 24 hours prior to any surgery. New papers saying maybe that's not so much the issue. And then what I would do as well is anything you can use to adsorb junk. So high fiber chia seeds are a great option. You can use, again, C60, fulvic and humic acid, many of these options. And then the other thing is too, since you know there will be many extractions, I would encourage you to find a box of Yunnan Baiyao, which is a Chinese herbal formula that is used to control bleeding, amongst other things. It fell into huge favor because it also seems to reduce the spread of hemangiosarcoma in dogs. And what I would do is give, and talk with your vet about it if you think they will be okay with this, but I would give 2 of these capsules the morning of anesthesia. Ask if your vet's cool with it, give them, there's a little red emergency pill in the package of capsules. And what this is going to do is help reduce the bleeding, because if there's infection, there's inflammation in the gum. And if we reduce the bleeding, then everything will start to heal a bit better. The vet will have a better time in terms of extracting the teeth as well. And then afterwards, you want to continue doing this detox. So again, high doses of omega-3 fatty acids, milk thistle, liposomal glutathione to support the liver's ability to get rid of the garbage that's in the body. And then most likely this dog will be on probiotics. So again, Megaspore would be, he'll be on antibiotics. Megaspore is the probiotic I would suggest. Poor buddy. And the reason is that it's been shown to really protect the microbiome in the face of antibiotic administration. So all of those things will be helpful. Cold laser therapy, pulsed electromagnetic frequency therapy, again, is going to help this whole area in his face heal up. Yeah, they are. So high doses of essential fatty acids are going to be somewhere on the order of 100 to 200 milligrams per kilogram per day. So for a 50-pound dog, that's going to put them in the neighborhood of around 3,000 milligrams or more per day. So pretty high. Yeah. And as what I typically use for vaccine detox is Thuja, and you can use it both as the mother tincture or as a 6C or 12C homeopathic pellet. And that's done very well for both rabies and any other vaccines that the dog is required to have. Well, you're welcome, Jen. I hope that's helpful. What else can I help you with, ladies? Cool. Let me share this screen one more time so you can get the QR code for the book. And if you've got questions, keep asking.
Dr. Ruth, yes, I had a question about the mat. Did you say you sold those on your site as well? You said that you had they're the PEMF. Is that what they're called? The PEMF?
Exactly. It's Pets PEMF, Pets PETS PEMF. But yeah, these things have just been outstanding.
I've been looking at them, but it's so hard to determine which ones are good and which ones are not. So thank you.
You're welcome. Yeah, and for frame of reference on those, I've tried a CC Loops. I've tried BioBalance, which is a human one. I never did do the Beamer. I think they're very expensive, and I don't know that they offer that much more power.
They're ridiculous. Yeah, outrageous.
Yeah, ridiculous. Yeah. Yeah, and that's it. So the developer, yeah, the great question, Delora. What are better spay neuter options? But the developer of this product is looking at hemp products and thinking, why are they so expensive? And so we fixed it. So the other thing I was going to say to you, Bonnie, in terms, and thanks for reminding me about spay-neuter options, Delora. If you're, so look at a site called dogsterone.com, and I'll type this in.
Okay.
And if my theory is correct, and I think it is, and there's a lot of research to say that it is, that early spaying neutering is contributing to 20 to 30 times the level of luteinizing hormone as should be in an intact animal, and tissues that should not have LH or luteinizing hormone receptors do. One of those tissues, sadly, is the brain. And this is part of the reason that we see so much anxiety, so much cognitive dysfunction.
Yeah.
So if we can find a way to stop that LH production, then that's going to help tremendously, right?
Mhm.
So dogsterone is a guy named Dr. David Bieber teaching veterinarians how to use testosterone injections, which the FDA says we can do for dogs that have osteoarthritis or the frailty of aging. And the reason this would be important is that testosterone injections are going to shut off the production of gonadotropin releasing hormone, because now there's a feedback mechanism happening again. And when that happens, then production of luteinizing hormone gets shut off. And then when that happens, many of these conditions start to go away.
Mm.
And the cool thing is that Dr. Michelle Kunzler, who was at the Corvallis Veterinary School, University of Oregon, did this research for a company that's looking at selling a gonadotropin releasing hormone blocker that sadly is not available in the US for chemical castration of the dog or cat. But what she's finding is that this is such an effective support mechanism. She's been trying to get research money to use this GnRH blocker to treat lymphoma in dogs, which is shocking, right? Because if this is the mechanism behind 50% of dogs over 10 having cancer, if we can shut the mechanism off, then we can support these guys much better. So on the, so having said all of that, if your dog has already been spayed and neutered, you can't put the ovaries and testicles back in, but what you can do is support digestion and detoxification, because if the liver has all of the backlog of crud sort of filtered out because phase 1 and phase 2 are functioning properly in terms of detoxification, then it can help to remove the excess level of luteinizing hormone from the bloodstream. And then we start to see whatever the chronic disease is that has shown up, Addison's, atopy, cognitive diseases, we were talking about cancers, arthritis, cruciate ruptures, all of these things, we start to see them improve because now this thing that has been luteinizing hormone that's been there in such hideously high numbers has gone away. The tissues no longer have the receptors. They start to go back into a state of homeostasis.
Oh. So are you saying that as far as you mentioned their testosterone injection, so is that something is that something I can go to my vet and ask her for, or no?
You can. But I would go to this site, dogsterone.com, read about it and see if there is someone that has trained in your area with this technique. That's the easier path. If there is not, then take this to your site, to your vet.
Got it. Okay. Yes.
Make sense?
Yeah, we have no holistic vets, which was sad because I did in the region that we lived in previously, but there I've not found any, unfortunately. But yes, I will check that out. Thank you so much. That's amazing information.
You're welcome. And yeah, so, and then Lisa, you're asking about omega-3 fatty acids. Got it. So in terms of if your dog has lymphangiectasia, you don't want to use a lot of oil-based products, and that's true. So that's where, you know, if you use other things like C60 and fulvic acid, humic acid to help adsorb some of the garbage, then that's going to help reduce the load on the gut. And again, we will make sure to get you some information out on this, but I think these cases are so complicated because this is the point where in humans they're considering doing GI transplants, no kidding. So where they literally transplant the whole intestine. These are difficult deals to sort through, and this is where it's going to be critical that you work with somebody that can walk you down that path. Yeah, Jen, CBD. We love Angela's other product, which is CBD Dog Health, and they have one called Ease. So again, on the website, there's the hemp oil Ease, which is a way to get around the powers that be by not saying CBD. So that's great help. Arnica, PemphMat, there's a whole myriad of options too. And Kelly, umbilical hernia is tough to say because I'm not looking. So if it's a problem that is like, if it's big and stuff is popping out and it's getting bigger, then maybe it requires surgery, but maybe it doesn't. And if you can delay, sort of back to that early spay neuter thing, if you can delay using or doing the spay neuter procedure to at least 2 full heat cycles, and probably better is at least 5 years and possibly never. That's where things get so much better because we're keeping this animal endocrine competent. Now, if that umbilical hernia gets better or bigger rather, then that's where you may have to consider surgery. But if they're tiny, yeah, it may be an issue. A lot of times if they stay this size, they'll sort of scar off. So I think you just have to kind of watch it and see. We tend to want to do, my profession tends to want to do surgery a lot faster than perhaps we should, because that's, well, we can fix this. So just kind of take that with a grain of salt. All right, so good. She's had a couple of, yeah. Yeah, Jen, you can certainly use a grounding mat because again, these guys, you know, for instance, do you know the smart plugs people are using that connect via Wi-Fi to turn lights off and on? Dogs are like, people will turn these things on and they're like, freaked out and exhibiting all sorts of bizarre things because the electromagnetic frequencies are really messing with their poor little brains. And remember, their heads are really close to the level of the socket. So it's like they're getting a straight line in. So grounding can absolutely be helpful. And that's part of what PEMF will help do as well, as realign the wave frequencies in there. Well, yeah, let's see. I think we got one more. Right on. Yeah, she loves it. Yeah, and that's it. That's telling you something. She needs that support. So that's really cool. And as I think you've got one more question in it, and then I think we'll wind things up.
Hi, Doc. So thank you so much for the opportunity. What do you think about the energy healing, like on-hand energies? There is like a boom of therapies. I currently myself doing energy healing. So what is your opinion about it?
It's beautiful. It works.
It
and
works.
this is and this is something that you can help teach pet parents how to do. And I think the other thing is learning how to clear energy for our pets. So this is a video I did some years ago. And what you're doing is clearing your pet's energy, but you're also at the same time clearing your own. So I think it's a very useful, practical thing. I think the other thing is too, is that most of us get so caught up in our day-to-day trying to get all the stuff done, the dings, the bings, the notifications on our phones, the computers, and we rarely take time for ourselves to shut this all off, to take 3 minutes to calm down, right? And to be present. And this is what our pets are craving more than anything else from us. If you can commit to spending 3 minutes a day with outside, preferably under a tree, in your favorite field, at your favorite vista, what have you, with your pet, you will do so much to help them. That's all they really want from us, is to see us centered in our own being and help them be centered in their beings, because they are reflecting back to us the madness that comes with modern life in many ways. So thank you for bringing that up. So ladies, thank you so much for everything, for being here today with me, for getting what we're doing. Tell all your friends. We need to, we have over 50 coaches that have been certified. They need clients, and we need to help people understand this service is available, so that if you are like Bonita, you've moved to an area where the vet's completely conventional and they're like, no, they're putting up the skull and crossbones on anything you're asking them about. Take a deep breath and relax and know that you have a backup plan. Right on. And Laura is one of our animal communicators. She's got some really intense abilities and skills there. So thank you again. Looking forward to learning how we can help you. Go get the book. If you're not feeding real food already, start that today. Okay. Thank you much. We'll talk soon, I hope. Cheers. Bye.